right, welcome back to ABA exam review and the continuation of RBT practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. So you know, we recently posted our updated version of the RBT study guide review. This is covering the 3rd edition task list, which will go live January 2026. So if you plan to take next year or take the 3rd edition, please check that video out. We covered the whole task list, just like we did for the 2nd edition. As always, check out btexamreview.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout-out. Work hard, study hard. Let's get going. You're teaching a client to identify colors. Initially, you point directly at the red card while asking touch red, controlling prompt. The client consistently touches red. Over several sessions, you gradually move your point from directly on the red card to near the red card to just above the array until you're no longer pointing at all. The client continues to touch red correctly. What procedure have you implemented? So we have a procedure or intervention question. And what are you doing in this scenario? Well, let's gather some information. We know we're teaching colors. Initially, we're pointing at the red card while asking touch red. So what does it mean to have a controlling prompt? Well, the prompt essentially becomes a temporary discriminative stimulus. And the reason we want to fade out the prompt is we want the actual stimulus that we want to control the behavior to become the SD. So we don't want the prompt to be the SD, we want touch red. So over time, you are gradually moving from pointing to pointing near the red car to pointing above the field until you're no longer pointing at all. You've essentially moved from giving the answer to no prompt whatsoever. What procedure have you done? A. Prompt fading to transfer stimulus control from the point to the verbal instruction. Exactly. Initially, the point is our SD. As we fade, the verbal instruction becomes our SD, and that's what we want. We want the verbal instruction to have control over the behavior. Read all your answer choices. B. Shaping by reinforcing successive approximations. Based on our information, we aren't looking at successive approximations, or at least it is not specified in the question. C. Backward chaining of the color identification response. Are we using backward chaining? Well, it's unclear. We just know we're using a prompting procedure and we're fading out that prompt. The extinction of incorrect responses. Again, we may be using extinction, but you've got to go by what information you're given in the question, and the question does not specify if that is the case. So the procedure you've implemented is A. Prompt fading to transfer stimulus control from the point to the verbal instruction. Your client engages in hand flapping at high rates. The BCBA implements a DRL, differential reinforcement of low rates, procedure where the client earns reinforcement if hand flapping occurs 5 times or fewer during a 10-minute interval. Previously, the client was flapping 20 to 30 times per 10 minutes. What is the goal of this DRL procedure? So a DRL is a differential reinforcement procedure. And remember, differential reinforcement, we are reinforcing a target and putting other things on extinction. And with the DRL, what we're typically trying to do is reduce a behavior, but not always eliminate it. So in this case, this client is engaging in hand flapping, and the BCBA is not set out to remove it in this case because the client is still allowed to flap 5 times. Previously, they were flapping 20 to 30. So what's the overall goal of this procedure based on this information? A, to eliminate hand flapping completely and immediately. Well, it's not the case here because the client is getting reinforcement even though they still are hand flapping a little bit. B, to gradually reduce the rate of hand flapping to a more acceptable level. Yes, slowly but surely, the BCBA is having the client hand flap less and less. C, to increase hand flapping to higher rates. Well, of course not, right? That would be something like a DRH, a differential reinforcement of higher rates of behavior. And D, to teach the client when and where hand flapping is appropriate. Nowhere in the question does it say the client has to be in a certain situation or environment. All we're looking at is the number of times. We're focused on this DRL procedure. So the overall goal is to gradually reduce the rate of hand flapping to a more acceptable level. You're teaching a client to tie their shoes. You use hand-over-hand physical guidance for the first few trials. Once the client shows some success, you switch to lightly touching their hands, then to just hovering your hands nearby, and finally to no physical prompt at all. What prompting strategy are you using? Okay, we have another great prompting question here. We know we're teaching a client to tie shoes. You start with hand-over-hand physical guidance. After some success, you are now lightly touching hands, then hover, and then no prompt at all. What way have we moved down the prompt hierarchy? Well, hand over hand to no prompt or hand over hand to light touching is definitely moving down, right? We're starting at this highest intrusive prompt and moving downward. So, what prompting strategy have we used? A, least to most prompting. Well, if we're starting with this physical hand over hand guidance and then going to just hovering hands and to no prompt at all, we're definitely not going least to most. We're starting with the most intrusive we have and then lessening it and lessening it and lessening it. Time delay. What is a time delay? A time delay is where we give someone a certain amount of time to answer before giving the prompt. That is not what is happening here. And then stimulus fading. We are prompt fading, but we're not necessarily changing the stimulus around. We're just fading out our physical prompting, which means we are going most to least. We're starting with the most intrusive and reducing it more and more as we go. You're collecting ABC data on a client's screaming behavior. You observe the client is working on a puzzle, and then the client screams as loud as they can. You remove the puzzle and allow a break. The screaming behavior increases in future sessions when puzzles are presented. What is the consequence in this example? All right, pretty easy and straightforward question here. We're looking for the consequence, right? Now let's think about ABC. We have an antecedent, behavior, consequence. Antecedent comes before the behavior. The consequence does what? It changes behavior, right? Either going to increase it or decrease it if it's one of our principles like reinforcement or punishment, whatever it may be. So in this case, you're collecting ABC data on screaming. You see the client is working on a puzzle. The client screams as loud as they can. You take away the puzzle and give a break. Now what happens? The screaming behavior has increased. So our antecedent is what? Well, they're working on the puzzle because our behavior is client screams as loud as they can. The consequence is puzzle is removed, break is given, and it causes the behavior to increase in the future. So what's our consequence? Well, it's going to be C, removing the puzzle and allowing a break. Working on a puzzle is the antecedent to the screaming. The screaming is changed by the consequence. And then removing the puzzle and allowing a break is the consequence itself. The increase in future screaming is the effect of the consequence, not the actual consequence. Don't mix those up. Remember, consequence is our punishment, reinforcement, and extinction. You're conducting a pair of stimulus preference assessment with a client. You present 2 items at a time and record which item the client selects. You present each possible pair of items multiple times across trials. After completing the assessment, how do you determine which items are most preferred? Okay, so what does a paired stimulus or a forced choice assessment help us do? Well, if we have, let's say, 3 items, okay, we can make it 4. We're going to present A and B, A and C, D and A, B and C, D and C, so on and so forth, right? Until we have all the different combinations. You're going to present them. You're going to ask the client to pick one. They're going to pick one. You record it. In this case, how are you going to determine which items are most preferred once the assessment is done? A, the items selected first are always the most preferred. Well, that's not necessarily true, right? Because we're going to compare all items against one another. We want to see how many times each item was chosen. B, calculate which items were selected most frequently across all presentations. Yeah, if they picked A every single time, A is going to be the most preferred. C, the items the client played with longest are most preferred. They may have picked B and played with it for 10 minutes, but maybe they only picked B once, and they never picked B again, right? And so maybe that one time B was, but they aren't picking it, so based on our forced choice assessment, it's not going to be the most preferred. D, ask the parent which items they think the client prefers. Absolutely do that. That's a good history, but it's not going to tell us which items are most preferred. The actual assessment will. So we're going to calculate which items are selected most frequently across all presentations. Thanks for watching. Check out btexamreview.com for all of our study materials. When you pass your exam, let us know so we can include you in